class. My name's Deb Tedone, and I'm going to be your instructor for Module 6. We are going to do a lot of different things together, and I think what I'm going to do throughout the module is do some short YouTube videos to give you some further instruction as required. We wanted to go over Module 6 with you and what's expected the first week during this module. Overall, during the module, we're going to be doing a lot of community information, and you're going to learn about different kind of community nursing, how the community nurses work out in the community. We'll be working on epidemiology, different disease processes, and public health, and you're also going to be learning a little bit about education. That's something that we do in the community a lot, and as nurses we always do it. And the education portion, you're going to be learning different types of people for learning, different types of educational needs, and you'll be learning different aspects of community nursing with teaching, and I think that you're going to enjoy that. Throughout the module, you will have journals, you'll have PowerPoint presentations, and of course you'll have your DQs to answer throughout. And the more you participate, the richer the experience is going to be for you. You're also going to have 3 different things during Module 6, and I've worked with some of you on these already. You're going to be working in the community for 16 hours, and that's going to be your community practice experience. What this is during Modules 6.4 and 6.6, you do not have any classes. You don't have any classwork assignments. What you're going to do during that time is these 3 community requirements. The CPE, or the Community Practice Experience, is something that I've been scheduling with you and for you for the past few weeks, if not several months. If you have not received your assignment yet, you will within the next week. Sometimes it takes weeks to months to get these assignments solidified. Working right now with one agency, I've had the student names in for quite a while, but she has to bring them before her board, and they don't meet until the 13th of the month. So that's kind of, I can't really do anything until I hear from her with that. But I do my very best to give you exactly what you've requested on those questionnaires that you've turned in. And the second part is discharge planning. Now with discharge planning, you don't have to do discharge planning. What we want you to do is to follow a discharge planner for just half a day. And when you follow this discharge planner, we need you to fill in a form that tells us exactly what you learned from the discharge planner. This is something that students have had a lot of success with in the past, and they enjoy it. They've learned a lot from it, so we've kept it in the program. But it's only for 4 hours. It is not for any more than that. And the last part is also community agency work, but this community agency work is you're going to be visiting at least 2 community agencies, and when you're in those agencies, you're going to ask them questions about that agency, and there is a guide in our syllabus to show you how to do that and what you need to ask. Lots of times nurses, when they do this, they pick up brochures, or they talk to the administrator there, or they talk to one of the head nurses, whichever is easiest for you. That could be at a Red Cross, it could be at a Salvation Army, it can be at a AIDS center, pregnancy center. It could be any place you choose that deals with community, anything that is not acute medical care. And there's also some recommendations in the syllabus for that. For 6.1, what we're going to have you do specifically, and it's in your Moodle, of course, and I'm going to be pretty much telling you exactly what's on this Moodle. And it's all there in black and white, but I'll explain things a little bit further. We know what our objectives are, and it's the community and promoting wholeness is the name of 414, Community 414. By the end of Mod 1, you're going to be able to, or by the end of Week 1, you'll be able to define and describe a community, what a community is, and the historical roots behind community health nursing. You're also going to assess a community using nursing assessment models and describe Newman's model of nursing care, and that's Newman, Neumann apostrophe S. You're going to be applying Newman's model of care to individual clients, family, and or community in some assignments. So make sure that when you read up on Newman that you understand what you're reading and what's needed. You're going to compare and contrast public, global, and community health with each other. There are several readings and articles to read. The book we use is from the authors Harkness and DeMarco, and it's a very good book. It's very easy to read, very easy to understand, and I think that you'll get some benefit from reading the chapters that are assigned, and the articles are all specific to the week's work. You're going to review the course on the Moodle, the PowerPoint presentations found in the course in the resources folder. And there are several, but all of them are very pertinent to what you need for week 1. So if you will please watch all of those, and if you have any questions whatsoever, please let me know. You're also going to review the information on the windshield study. The windshield study is something that you're going to be doing in your community, and it's also found in your Moodle. There's a really good explanation of what the windshield study is. It asks you in here to look at a community on the internet, but I'm going to ask you something different. I want you to look at a community that you live in or that you have lived in, somewhere where you can actually get some information from surroundings that you know. And I think that most of the students get really good benefit out of this, because they are learning about other people's environments, and they're also learning more about their own environments. We're going to choose a community to access, and then utilizing Anderson and McFarland's model of community health assessment, you will complete a community assessment of your chosen choice. And the Anderson and McFarland's model of community assessment is found in the rubric right here. And as you can see, right there, that's what you need to be looking at, that A through H. You're going to be looking at their community's physical environment, education, safety and transportation, the politics and governments that rule that particular area, health and social services, communication, economics, and recreation. And then you're going to look at the rubric, and it'll give you all the information that you need to include on the PowerPoint that you create for your windshield study. And I don't think I've ever had a student complain about the windshield study. It's something that's kind of fun, because you get to learn about a place that you've always lived in, or that you're familiar in, or that you wanted to know about. After that, you're going to be reviewing the grading rubric for the windshield study and review the guidelines for completing the windshield study. This will not be due until week 6.3, but it's not a bad idea to get started on it now. Your other activities are your application of community assessment, application of Newman's model, complete the where will you choose to take your dream choice on the course. That's for your online participation. Number 2, you're going to determine which community you're going to assess for the windshield survey, and you're going to look at the materials in the student guide regarding that. And you will create a journal entry on the Moodle system prior to the week of 6.2. So your journal articles and your DQs are all due before the 18th. And I think that your DQs should probably be in by the 15th. That will give your classmates time to look at your responses and time for you to respond to theirs. And the journal entry itself has 2 parts, and you will just go in and answer those accordingly. After you do those and you do your DQ, you will be able to rest and be able to communicate with each other. If you have any questions whatsoever during any of this material, during the assignments, please let me know. My phone number is area code 594-6137. And this is the mode of, this is the best way to get a hold of me. My cell phone is good for text messages, but for some reason it does not always pick up messages quickly. The text messages are quickest for me. So if you have a very urgent problem and you need me to call you back immediately, please text me. And my cell is 585-301-5662. I do check my emails in our system at least 4 or 5 times a day, every day, and that's 7 days a week. So if you have any questions or any problems, you can email me and be assured that you will get a response in not too long. And if you email me something and want me to look at it immediately, send me a text and say, please check email, and that's fine. I'll stop whatever I'm doing at that time if possible and check your email. And I also want to tell you that this is your class more than my class. I want you to learn from each other. It's so important. I had been a community health nurse for 22 years, so I know community health, and I will be able to help and to guide you through this course with my knowledge. Community health is something that is very, very popular right now, and it's going to become even more popular. For those of you that are currently working in a hospital system, you know that patients are being pushed out faster and faster to the home environment. And when they go home, they need a nurse many times if they're being sent home with acute illnesses still, or with chronic illnesses that require a lot of teaching and modifications to their lifestyles. And there's also quite a bit of epidemiology, and this is something also that's a rising concern in our community as more and more parents are opting to not vaccinate their children. So we're having some outbreaks of measles and different disease processes that were once not that big of a problem, and now they're a pretty big deal. I want you to work well with each other also. When we have assignments and they require working with a partner, I will send you the list of the partnering. And between the 2 or 3 of you, there'll be one group of 2, one group of 3, because there are 5 of you. Between the 5 of you, you will decide which topics you would like to work on. I'd really rather do that than assign the assignments myself. I want you to be able to work on something you are interested in as a group. And that's it for now. I will talk to you soon. I will probably send you a YouTube frequently. Also, I would like to do some Skyping if you would like. So any of you that want to Skype and talk to me about a question, that's fine. Just give me a day and a time, and I will be available and call you for Skype. And that's it. I'm very, very happy to be working with you, and I hope you have a wonderful experience in Mod 6. And God's blessings to each of you, and I will see you all soon, or talk to you all soon. Bye-bye.